But first, the latest developments in the Rhode Island hospital nurses dispute. If the hospital healthcare workers do go on strike on July 1st, they will not be alone. The Teamsters have told 12 News that they'll honor the picket line. The health department, meantime, is studying the contingency plan submitted by hospital administrators, and the next bargaining session between the union and the hospital is scheduled for Friday. We begin our Team 12 coverage tonight with 12 News reporter Mark Economo, who's live at the Lifespan Health headquarters in Providence. Good evening, Mark.
Good evening, Jim. A very large show of solidarity today for Rhode Island hospital nurses as time ticks on the current contract.
Hey, hey! Ho, ho! Mandatory, let's go! Hey, hey!
Hundreds of members of the United Nurses and Allied Professionals rallied in front of the emergency room at Rhode Island Hospital today. From there, they marched to Lifespan's headquarters on Point Street. At issue is mandatory overtime. Union members say they are being forced to work double shifts, like this woman who has 3 children and says mandatory overtime is taking a toll on her family.
It's very difficult, especially if you don't have someone to watch your children. My parents are elderly. It's very difficult. I feel like I'm imposing on them.
Yesterday, both sides met for 7 hours, the hospital saying they put a number of offers on the table, including limiting mandatory overtime to 12 times a year and offering employees incentives and giving more holiday shifts to temporary employees. But the union says that's not good enough.
Lifespan put something on the table which shows you that they totally do not understand that as much mandatory overtime as they put on the table is unacceptable.
If there's no contract ratified...
Meanwhile, the Teamsters, which represents nearly 2,000 more Rhode Island hospital employees, met this morning to decide what they would do if the UNAP strikes.
There are some serious issues that need to be fixed.
Will you honor UNAP's picket line?
Will we honor their picket line? Yes, we got to honor anyone's picket line.
Now, ironically, the Teamsters contract is up on September 30th, and Jerry O'Connor says one of their sticking points when that contract comes up is mandatory overtime as well. According to Lifespan, the contract, which is up on September 30th, has a clause in it, a no-strike clause. But Jerry O'Connor said that they will honor UNAP's strike line if need be. Now, the next round of negotiations is set for 2 o'clock tomorrow afternoon. Live in Providence, I'm Mark Economo, 12 News.
Thank you, Mark. The Nurses Union also received some unexpected support today from Rhode Island's Attorney General. Sheldon Whitehouse fired off a letter to the president of the hospital, and in it, he expresses his concern about the issue of mandatory overtime. We'll go back now live to Providence, where 12 News reporter Christine Johnson has more on this turn of events. Hi, Christine.
Hi, Karen. Well, the letter is addressed directly to Dr. Joseph Amaral, the president and CEO of Rhode Island Hospital. Now, after doing a little digging, we confirmed with the Office of the Attorney General that a copy of that letter was faxed to the Nurses Union from Whitehouse's office. Now, his office says they did that out of courtesy to the union's members. The full-page letter from Attorney General Sheldon Whitehouse is very clear. When it comes to the issue of mandatory overtime, Whitehouse sides with the union. He writes to Dr. Amaral, the idea that repeated mandatory successive shifts are an appropriate personnel strategy is incomprehensive to me. If it were my hospital, I would not put up with treating them this way. I don't know why you do. The issue of mandatory overtime is one of the main sticking points in contract talks, and these nurses are happy that they have such a powerful ally on their side. For him to realize, we are people, to not be able to go home to our families is just astonishing, and they just keep practicing this. And I'm glad that the Attorney General is backing up the nurses.
It shows full support for his office and I think for the community in Rhode Island and southeastern Massachusetts for what we're doing. But they do not listen! Even though unionized nurses don't feel the president and CEO of Rhode Island Hospital is listening, he says he is.
We don't like mandatory overtime. No one likes mandatory overtime, and we want to continue to work at the bargaining table to create situations where mandatory overtime is unnecessary. But as an institution, we can't get rid of it. We have to protect our patients.
Now, as far as the fact that the Attorney General's office actually faxed this letter to the Nurses Union, Dr. Amaral only said that Mr. Whitehouse is entitled to express his opinion. Live in Providence, Christine Johnson, 12 News.